welcome to the second module of the Health Diplomacy series. My name is Mary Secco, and I am Chair of Global Advocacy for the International Bureau for Epilepsy. It is my distinct honor to be able to walk you through this e-learning module, which was developed to help you to better understand the role of the WHO, or World Health Organization, IBE, and other non-state actors. The learning outcomes for this second module are to improve understanding of the role and function of the WHO, to review the mission of IBE, and to improve understanding of the politics of health. The primary channel of global health diplomacy remains negotiating between states within the framework of the UN system. The WHO is a United Nations agency. They are the global organization for directing and coordinating global public health. WHO has the constitutional mandate to coordinate international health and establish international norms and standards that relate to health. The WHO Constitution was signed in 1946, and here are some relevant statements from that Constitution. The health of all peoples is fundamental to the attainment of peace and security. Governments have a responsibility for the health of their peoples, which can be fulfilled only by the provision of both adequate health and social measures. The extension to all peoples of the benefits of medical, psychological, and related knowledge is essential to the fullest attainment of health. An informed opinion and active cooperation on the part of the public are of the utmost importance in the improvement of the health of the people. IBE is a non-state actor in official relations with the WHO. Official relations is a privilege that the Executive Board may grant to non-governmental organizations, international business associations, and philanthropic foundations that have had and continue to have a sustained and systematic engagement in the interest of the organization. IBE is expected to contribute significantly to the advancement of global public health, and for this reason, IBE has a written contract that's reviewed yearly with the WHO. IBE chapter personnel and volunteers have been invited on many occasions to engage in advocacy related to improving outcomes for people with epilepsy. As non-state actors, we cannot vote, but we can attend consultations and are often asked to provide input, technical guidance, and comments. IBE was granted official non-state actor status with WHO because our vision, aspiration, and values align with the WHO Constitution. Our IBE vision is transformational social change for people with epilepsy worldwide. We aspire to advocate globally for epilepsy and to support service provision locally by empowering organizations and advocates worldwide. And our values are consistent with WHO values. They are people-centered, inclusive and collaborative, accountable and sustainable, and impact-oriented. IBE has published a strategic plan. In the plan, IBE will prioritize these goals to achieve a social change for people with epilepsy worldwide. The goals are to position epilepsy as a global public health priority, which aligns with the work IBE does with the WHO. It is also to empower and amplify the voice of people with epilepsy and to ensure that we continue to serve and support our chapters and committees in all regions of the world. The IBE strategy at a glance is available on the IBE website. It is a useful tool for you to use in your advocacy work. Other non-state actors in official relations, for example, the International League Against Epilepsy and the World Federation of Neurology, are also working with WHO to improve health outcomes for people with epilepsy. International organizations supporting people with other neurological conditions, for example, dementia, stroke, and MS, also have non-actor status with WHO. as do patient organizations and groups like Health Action International, who are working to improve access to essential and safe medicines. WHO affirms that healthcare is a fundamental human right. They define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It is understood that good health allows children to learn and adults to earn. Good health helps people escape from poverty and provides the basis for long-term economic development. This slide is used to talk about the WHO organizational structure. At the bottom, holding up the structure, are the member countries, 194 countries from around the world. Each of these member countries is within one of the 6 WHO regions. These regions are the African region, the region of the Americas, the Southeast Asian region, the European region, the East Mediterranean region, and the Western Pacific region. In most instances, IBE has aligned their chapters within WHO regions. In the middle of the triangle is the WHO Secretariat. The WHO Secretariat carries out routine operations and helps implement strategies. It consists of experts and staff and field workers who have appointments at the central headquarters, which is in Geneva, or at one of the 6 regional WHO offices, or at other offices located in countries around the world. The Director General of the WHO is elected by the member countries. He is currently Dr. Tedros Adhanom Ghebreyesus, who is from Ethiopia. He is currently serving his 2nd term and is the first African to hold this position. He is a former Minister of Health and Minister of Foreign Affairs for Ethiopia. In green is the Executive Board, which are 34 individuals who are qualified in the field of health, each one designated by a member state. Member states are elected for a 3-year term to the Executive Board. This year, 12 of the 34 countries that make up the Executive Board were replaced. There is a quota for each region. The role of the Executive Board is to manage the enormous agenda and provide governance for the Secretariat. At the top of the pyramid is the WHA. Each year, 4,000 delegates attend the WHA, which is the World Health Assembly. The World Health Assembly is the supreme decision-making body of the WHO. The World Health Assembly is usually held in Geneva, usually in May of each year, and is attended by delegates from all member states. It is at the WHA that resolutions are passed. So global health diplomacy is both political and diplomatic. We learned this in the first module of the Health Diplomacy series. In most cases, the day-to-day negotiations are conducted by health attachés who are based in Geneva. The permanent mission of a state receives instructions from their national government, and they seek to ensure that the state's national position and interests are reflected in the outcome of the negotiations. The effectiveness of smaller missions may depend on the personality and context of the health attaché, but it also may depend on club diplomacy, which is also something we spoke about in Module 1. The UN principle of universal representation, one vote for each country, irrespective of size or level of development, is how voting works at the WHO. The higher level representatives, ambassadors or ministers, join the meetings when there are major decisions that need to be adopted. The WHA, or the World Health Assembly, is a week-long meeting which takes place each May in Geneva, Switzerland. More than 4,000 delegates attend this meeting. Negotiations at the WHO are aimed at reaching consensus. Consensus building allows policies to move forward, but may also mean losing strong language or setting aside certain policy options in favor of passing or adopting a resolution that is acceptable to all 194 countries. Much of the diplomacy is about coalition building, so delegates address the conflicts in health through building consensus. Through this process, they legitimize certain courses of action by formally adopting and endorsing resolutions and other WHO policies. So what's critical if you want a resolution to be passed is that the way the proposal is developed makes a huge difference. And transparency elicits support and includes dialogue and consultation, not only with member states, but also like civil society, actors like the IBE and the private sector. So how do you successfully negotiate the WHA? Well, norms or wording should be agreed upon beforehand and then legitimized formally at the Assembly. Showing up at the WHA provides legitimacy to actors. The formal structure of the event facilitates cohesion and networking because it creates a space for the informal side of global health diplomacy. Rules and procedure are very important at the WHA, and they control the proceedings. They dictate who can speak when and under what circumstances. And again, non-state actors in official status like IBE can speak at the General Assembly, but they do not have a vote, and they're often asked to speak last. Influence can also be obtained by knowing which side events to attend, or by knowing who to meet with informally, which can often happen within the lounge of the WHA buildings. IBE and the ILAE have been working with the WHO for more than 2 decades, beginning with the Global Campaign Against Epilepsy. In 2019, WHO, IBE, and ILAE published a 145-page report, Epilepsy, a Public Health Imperative. Summaries of this report are available in the 6 official WHO languages, which are English, French, Spanish, Russian, Chinese, and Arabic. In May 2022, all 194 WHO member states approved the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. In this plan, there is a 10-year roadmap to improve the health and social condition for people with epilepsy and other brain diseases. To support implementation of the global plan, the WHO published a technical brief, Improving the Lives of People with Epilepsy. This was published in December 2022. The technical brief contains 11 levers for change. Copies of these documents can be found on the IBE website under the Global Advocacy tab. On May 27, 2022, all 194 WHO member states unanimously approved the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, often referred to as WHA 73.10 or IGAP. Full details of the road to resolution can be found on the IBE website under the Global Advocacy tab. A resolution is the pinnacle of support for member states. Passing of this IGAP resolution reinforces that member states understand and agree that epilepsy is a public health priority. The resolution is significant because it includes an action plan with global targets and commitments. Now, while it is non-binding legally, which means member states will not be penalized if they do nothing towards implementation of the global goals, it is, however, a major endorsement that was passed in good faith. It should be leveraged to the country level. For this reason, we have developed 2 other modules in this series to help you to understand how you can leverage the IGAP for action on epilepsy at the national level. So 4 international organizations and 116 member states spoke in support of the plan, which was passed unanimously. And the IGAP will address challenges and gaps in providing care and services for people with epilepsy and other neurological disorders that exist worldwide, and it'll be used to ensure a comprehensive, coordinated response across sectors. This second module in the Health Diplomacy series was developed to help you to understand the role of the WHO, IBE, and other non-state actors. These are the key takeaways from this module. WHO is a United Nations agency. WHO has the constitutional mandate to coordinate international health and establish health norms and standards. WHO affirms that healthcare is a fundamental human right. IBE is a non-state actor in official relations with the WHO, and each of the 194 member states has an equal vote at the World Health Assembly. WHA 73.10, or IGAP, was unanimously passed by member states at the 75th World Health Assembly in May 2022.